Hey there, everyone. Mike Mibach with KTVU Fox 2 in the San Francisco Bay Area. September is Suicide Prevention Month, and to talk more about this is Dr. Dean Aslinia with the University of Phoenix. And it's important, Doctor, to talk about this, especially now during this pandemic. And I'm looking at the CDC numbers from over the summer, and I don't know if you saw these, but 40% of Americans polled did report mental behavioral challenges due all because of COVID-19. I'll just open up the conversation, kind of getting your reaction specifically to that number there.
Sure, absolutely. Yeah, thanks for having me. And yeah, this is absolutely a very important conversation to have, not just because of the COVID, but even before the pandemic began. You know, this is through the World Health Organization's reporting and data. It's the second leading cause of death for individuals aged between 10 to 24, and the third leading cause of death for individuals ages 15 to 44. So it's a huge problem for us regardless, but this pandemic has certainly exacerbated the issues of depression and feelings of isolation and feelings of helplessness and hopelessness for many individuals. And so it's becoming even a more important conversation because of the concerns that the pandemic has created for us.
Do you think, Doctor, it's more about the social distancing? You know, initially the stay-at-home order is so strict, at least where we are here in the Bay Area. Or is it more, I mean, again, it could be a little bit of everything, but it could be the loss of jobs as well. But what have you heard in regards to really, if you had to put a finger on it, it was just the isolation, or more is it the financial aspect?
Yeah. It's a little bit of everything, but one of the things that we're seeing on the clinical side that's most impactful is the feelings of isolation. And that is actually different than feeling of, loneliness or being separated from people. So that's what's, I think, important to distinguish here is isolation. While you can be isolated physically from others, you can still be connected to them. Versus if you're feeling depressed or if you're feeling lonely, while you might be isolated, you're actually, or maybe even if you're engaged with other people, you're still going to feel disconnected and or feel as though they don't get you, they don't feel any empathy for you, and feelings such as that. So it's very important to distinguish the difference between isolation and feelings of loneliness and or getting into states of depression where you might need to seek for further help.
And when you say isolation, you know, immediately I think of someone who lives by him or herself, you know, and that's not necessarily the case. I mean, it could be a family of four, a family of five, and maybe the parent you think, oh, they're fine, they've got each other, but that individual could be in a different place.
Absolutely. And so again, while that individual has a support system there to tap into, that doesn't necessarily mean that just because they're not alone, that they're safe from depression and or anxiety and or many other issues. So I think what's important when we're talking about suicide to recognize, especially for family members, to recognize a few things with your loved ones. Obviously, if they've come into this pandemic with a previously diagnosed personality disorder, and or any other type of a thing, if they've experienced bouts with alcohol or substance abuse, if they've had major depressive disorders in the past, if they have obsessive compulsive disorders, which create them to kind of get into these zones where they obsess about different things, whether that's going on shopping sprees and or just dwelling on the sadness that's happening in their life. So those areas are of concern because you want to pay attention to these individuals much more and feel that while they might be in the setup of a family, that they actually feel validated and they feel heard, and that the internal voices in their head do not take over the logical thinking, if you will.
I was going to ask you, what's the best way to approach that? You know, if I were to recognize that with one of my friends, I mean, what's the opening line without wanting to push them away? How do you exactly address this?
Yeah, beautiful question. Some of the things that you can do. Obviously, the biggest thing that I've recommended to many individuals and on different networks is to try to focus on the quality of your relationship instead of the quantity of your relationships during this pandemic. So focusing more on actually hearing your friends and feeling connected with them. So you actually have somebody who hears you, not just likes your pictures that you post on Instagram or on Facebook or any other social media. So it becomes much more of a quality setup for you. The other thing you can do, and there is a myth out there that you should never ask somebody who might be suicidal if in fact they want to harm themselves or harm somebody else. In fact, that's another thing. If you have the rapport with somebody, if you're a close enough friend with them, that you're noticing higher rates of irritability, if you're noticing major appetite changes in these people, if you're noticing them slowly becoming more hopeless and helpless and losing interest in the things that they used to like in life, and they're just not there anymore, they're just much more sad, you can certainly come out there and ask them, hey, you know what? I've noticed a huge emotional shift and a behavioral shift in you, and I'm concerned. Do you want to harm yourself or do you want to harm somebody else? Just going outright and asking them sometimes helps them feel validated that, you know what, you're actually seeing the pain that's happening inside.
You know, when I look at the CDC numbers, it says, 10% overall age groups contemplated suicide, 25% contemplated suicide within the age range of 18 to 24. And I guess that kind of took me by surprise. I should have looked up the numbers prior to that, before the pandemic, within 18 to 24. But because when I look at adults who are, losing jobs and millions of lost jobs across their way, not that a 22 or 23-year-old isn't working, or an 18-year-old for that matter, but I don't know. Were you surprised by that at all? Because I feel like it's, you're talking about late teens, early adult. Why is 25% of them right now contemplating suicide?
Right. So, no, actually, that wasn't a surprise for me,
Okay.
for a couple of factors. One being just simply the biological makeup of the brain. What we know about the brain is somewhere between the ages of 16 to about 24, what happens with the prefrontal cortex in the front of the brain, it actually, if you will, goes under construction. It goes under remodeling. And that's the area of the brain where consequences are processed. So when you're in that age range, everything gets rerouted to the back of the brain where pleasure is sensed. So this is where we sometimes see adolescents acting recklessly, or if, they feel like it would be a good idea to do something that otherwise an adult might feel is reckless, they will do it because it seems or sends a signal of pleasure. And so, again, consequences and being processed at that age range. And so that's where it becomes one of the most lethal ages when we're talking about suicide rates, because the individual just might think, you know what, nobody can help me, there is no hope for me. And if they feel like suicide is going to provide me that relief or pleasure, if you will, then they will act on it. Whereas an adult might actually contemplate much more from a consequence perspective and think about the different impacts it might have on different individuals in their life and actually pull themselves back.
I've just noticed in my own.
Quick, maybe.
Go ahead. Go ahead.
I was also going to highlight, the World Health Organization in their statistics provides for every suicide committed, there are about 50 suicides attempted. So, and this is a alarming rate, obviously, because those obviously and thankfully many of the attempts are not successful. But regardless, they're screaming for help, and we just need to be there for them.
And I was just saying, I bet a lot of people with them staying at home, not doing activities, sports, whatever it may be, working, they're on these. They're on your phones, you're on your screens more, and we know what social media and the peer pressure that has on young adults as well.
Absolutely, yeah. And I would not discount at all the pressure our youth are under with the constant barrage of the pressure, like you mentioned, with social media. If you remember, for us when we were growing up, we didn't have social media like this. And so if we were being bullied at the school setting, we could leave school and take a break from that bullying.
Yep.
However, a lot of the youth right now are exposed to this 24/7 nonstop bullying that they may feel. And that's where parents' engagement or just keeping a closer eye on the engagements that their youth have on social media can be beneficial from that.
And we can't leave the conversation without talking about the importance of Well, we already did about the conversation of communicating with your loved ones. But if someone's watching this just by themselves and maybe they don't have a lot of friends, maybe they don't have family around, it's okay to pick up a phone and call a national hotline or reach out to someone just again, just to keep the conversation going here, doctor.
Absolutely. Yeah, the national hotlines are available 24/7, and there are trained professionals who do nothing but to sit there to listen to people who need to be listened to. So, yes, if you're struggling with anything, if you're feeling sad, if you're feeling depressed, there is not only the national hotlines, there are so many different virtual telehealth counseling services available in every community now. So,
Yeah.
reach out to them and talk to somebody.
All right, Dr. Dean Aslinia with the University of Phoenix. I appreciate the conversation, a very important one to have as we make our way through this pandemic. Hopefully, on the back end of it, and we can get rid of COVID-19 sooner than later here. Thanks again, Doctor. Have a great day.
Thanks, Mike. Have a great one.